Alrighty, major features of the ulna going from top to bottom. Now, up here at the top, we have what is called the olecranon process. This is bony projection on the posterior side. It's what we commonly think of as our elbow. Now, if the olecranon process sounds familiar to you, it's probably because you've seen our prior video on the humerus. If we look on the posterior side of the humerus right here, we have what is called the olecranon fossa, all right? It's this little divot on the back side of the bone. So the olecranon process of the ulna interfaces with the olecranon fossa of the humerus, forming the majority of your elbow. And by having that fossa there, we can now have full extension of our arm. Lastly, in terms of related features between the two bones, we have what is called the trochlear notch, all right? So it's this little groove right here. It's kind of the back portion of the hook of our elbow joint. The trochlear notch interfaces with the trochlea of the humerus as so. Alrighty, moving along. Next, we have a very important feature called the radial notch. It's this little groove right here on the side of the bone. The reason this one is important is because it's one of the easiest ways to distinguish between left and right. Important thing about the radial notch is it's always going to be pointed in the lateral direction. It's going to be pointed towards the outside edge of the body. If I was to hold this up to my own body right here, you can see again this being the radial notch. You can see that is oriented to the outside or to the lateral side of the body, okay? Now, why is it called the radial notch? Well, it's because it sits quite nicely with the radius right here. So the radius sits quite nicely in that little groove right there. Last feature at the top of the ulna, we have what is called the coronoid process. It's this bony projection right here, and it essentially finishes out our little hook joint right here. Now, moving on to the distal end of the ulna, we just have one feature to note. It's going to be this little bony projection right here called the styloid process. Now, the styloid process, in reference to your hand, is going to be oriented kind of next to your pinky, okay? That's it.